Good evening, everyone. I think we can start the session. Before we begin, just a quick note, the session will be recorded for educational purposes. If anyone is uncomfortable being recorded, feel free to turn off your videos. By staying on, we assume you have given the consent. Okay. A warm welcome to all of you joining us today. We are thrilled to have such an enthusiastic group of for our latest journal club session. Whether you are a returning member or here for the first time, thank you so much for taking out time with and engaging with us. Let me briefly introduce SIMSOG, the Society of Indian Medical Students of Obstetrics and Gynecology. We are the India's first All India OBGYN Student Society with the motto of breaking boundaries and building hope. We are a growing network of passionate undergraduates and postgraduate students and beyond committed to revolutionize women's health. This journal club session is a monthly platform wherein we dissect research papers and dive into the future scope of innovation in OBGYN. We hope you enjoyed today's session. Now, I would like to invite our wonderful research team to quickly introduce themselves.
Hi, so I'm Zainab. I am the co-director of research team for this session. I'm looking forward to this journal club session.
Wonderful. I'm Ashika Sharma, and I'm the administrative officer in the research department. Okay. So we are extremely honored to have a very special guest, Dr. Nisarg Aravindan. Dr. Aravindan is the founder of Statifics Med, a NEET-PG faculty, and an AIIMS Rishikesh alumnus, currently pursuing his MSc at London School of Hygiene and Tropical Medicine. He is a collaborator with ICMR, NITI Aayog, and a passionate mentor in preventive and global health analytics. Thank you so much, sir, for for being here. We really appreciate your presence. Now,
Thank you so much.
yes, sir. Now, for the highlight of today's session, our presenter Harshita Yadav, a budding researcher and second-year BDS student, will be taking us through a crucial topic: the safety and clinical considerations of prescribing medications during breastfeeding. Harshita, we are excited to have you here. The stage is all yours.
Good evening, everyone. Thank you so much, Ishika. I'll quickly start sharing my screen. So let's begin. I have a quick question. How many of us feel hesitation while prescribing medications to breastfeeding or lactating women? The hesitation is common, okay. But what is more important is something we need to handle with evidence and clarity, not just caution. So today's paper provides us a science-based lens to answer the questions like can medications be used can medications be safely prescribed to the breastfeeding women's uh, introduction. So this is a prospective uh, cohort-based study which was conducted in Alberta, Canada. However, when lactating mothers require pharmacotherapy, concerns arise regarding medication transfer into breast milk and its potential effects on the infant. Uh, this presentation explores evidence-based strategies to guide safe prescribing during lactation, ensuring maternal treatment without compromising infant health. There are five core objectives of this paper. Firstly, the researchers aim to understand the physiological principles of drug transfer into breast milk and how pharmacokinetics influence infant exposures. Uh, Second, to explore commonly used classifications such as LACMED, HALES categories, and WHO to prescribe medications during breastfeeding. Uh, to critically review cohort-based research assessing the impact of medication use on breastfeeding outcomes. Uh, Researchers also promoted evidence-based, patient-centered clinical decision-making that balances maternal treatment needs with infant safety, uh, and to equip healthcare professionals with practicing tools and guidelines to counsel breastfeeding mothers breastfeeding mothers requiring medications. The study design, a prospective community-based cohort study conducted in Alberta, Canada. Women with chronic conditions were followed from late pregnancy, were followed from late pregnancy to 6 months postpartum to assess the impact of medication use on breastfeeding durations. Uh, the study setting. Uh, Participants uh, were recruited during routine prenatal care and followed postpartum uh, through structured interviews and clinical records over 6 months. Uh, Now moving on to key variables, there are six important key variables. Firstly is medication use. So this medication, this is an important variable. This basically tells whether the breastfeeding women's continued, discontinued, or never used medications during postpartum. Coming up to breastfeeding outcomes, uh, whether the mother stopped or partially or completely stopped breastfeeding. Uh, um, the third, maternal health conditions. This is again an important factor, whether telling us where type and presence of any chronic illnesses affects the breastfeeding outcomes. These chronic illnesses include hypertension, asthma, and anemia. uh, Coming up to demographic data, uh, data like age, education, parity, and healthcare access were equally important. Infant exposure rate, researchers equally gave importance to this topic, which is important because the depending on the drug, its solubility, lipid solubility, protein binding capacity, and the timing of the drug and safety profiles were taken care of. Decision factors, clinical advice, maternal concerns, and risk benefit perception. Now coming on to data collection method. The data was self-reported survey, clinical chart reviews, and postpartum interviews were conducted to collect the data. Bias and confounding, a potential self-reporting bias and a lack of randomization may affect the outcomes. Uh, the sample size, uh, all over the study included 346 participants based on follow-up availability. Now coming up to quantitative variables, breastfeeding durations. This was an important factor uh, uh, where it the duration was taken a note of. For example, 3 months, 6 months, and 12 months. The maternal age was also a key factor. Uh, Time to cessation, medication use status, whether uh, the mother completed the medication use or it was left incomplete, number of chronic conditions, uh, infant age and weaning, odds and hazards ratio, statistical method. Uh, Data were analyzed using descriptive statistics, t-test and chi-squares test for group comparison. Time to event data were analyzed using Kaplan-Meier curves and Cox proportional hazard models. Logistic regression was applied to adjust for confounders with p-values lesser than 0.05 considered significant. Uh, Now coming up to descriptive data, uh, the total number of participants were 346, with women having chronic health conditions. The common chronic illnesses were hypothyroidism, hypertension, depression, and asthma. Another important information was parity, mix of primiparous and multiparous women. Uh, their educational level and data were also recorded. Majority had higher education. Mm, Breastfeeding intention. Over 90% of the breastfeeding women intended to breastfeed their babies for more than a period of 6 months. Now, coming up to the most important point, the results. Uh, the 42% of the breastfeeding women used at least one prescription medication at 3 months postpartum, 30% at 6 months, and 33% at 12 months. Domperidone, which is an off-label uh, drug for lactation, was the most common medication at 3 months and 6 months. Let me tell you, domperidone is an dopamine antagonist which helps increase the production of milk during lactation, but there are but it is not licensed or there are no proven records for it. um, Breastfeeding women use significantly more non-prescription medications like multivitamins and vitamin D than non-breastfeeding women. There are other drugs which were used by breastfeeding women. Examples are amoxicillin for infection, cipralaxin, norethistérone, and levothyroxine. Subgroup analysis. So there was a site-wise difference seen in Canada, where in the area Vancouver, domperidone use was highest. On the other hand, in Edmonton and Manitoba, norethistérone was more prevalent drug. Uh, Breastfeeding women more often used vitamins, minerals, and GI agents, while non-breastfeeding women used more of psychotropics and opioids. Key interpretations. High medicine use in breastfeeding women show need for better clinical guidance. Off-label domperidone use is common, pointing to data gaps. Uh, Psychotropic use was lower in breastfeeding women, possibly due to the breastfeeding concerns. Uh, uh, Of course, no paper is perfect. There were some limitations to this paper. Uh, this was a self-reported data that may recall bias. Breastfeeding stop date not aligned with medicine start date. Uh, Study over represents urban educated and hospital birthing women. There are few clinical implications. Medication should be evaluated on a case-by-case basis in breastfeeding. Prenatal vitamins and certain antibiotics, for example, cipralaxin, appear safer. Off-label use such as domperidone needs closer monitoring. Generalizability, it was limited to Canadian urban population, may not apply to all mothers. Here are the key findings. 40% of the breastfeeding women used at least one prescription medication early postpartum. The most common medications were domperidone, norethistérone, and levothyroxine. Multivitamin and vitamin D were commonly preferred by non-breastfeeding women. Uh, Now coming up to clinical considerations, which we should consider while prescribing medications to breastfeeding women. Check infant risk. If the infant is premature or younger than 6 months, there is a higher vulnerability of the infant as they are highly sensitive. Choose safer drugs which have a shorter half-life and low milk transfer. Uh, use trusted while prescribing medications. Use trusted sources like Lactamed, WHO, they hail. Uh, timely doses. For example, take medications right after breastfeeding. Uh, Infant monitoring is also equally important. Watch for symptoms like sedation, diarrhea, and feeding issues. Uh, Counsel to mother. This is again an important factor. Explain the risk, signs, and safe use of these drugs. Here is a scope for there are a few scope there are options for a future research on this topic. Uh, Study safety and effectiveness of domperidone, uh, pharmacokinetics in lactating women, uh, breastfeeding safety profile of newer drugs, and use of antibiotics during breastfeeding and risk of infant gut dysbiosis. Uh, Thank you.
Okay,
Okay.
wonderful, Harshita. Now I would like to invite Dr. Aravindan to share his thoughts. Yes, sir.
Yeah. Uh, Harshita, thank you for the presentation. Have you heard of a checklist for cohort studies? I believe I had informed the team to tell you about the stroke checklist. Are you
Oh,
aware of
yes,
that?
yes.
Okay. Have you used it somewhere here so that I could see, if you have compared the quality of that paper against the checklist? Anything of that sort you have done?
Um, I'm so sorry, sir.
Hmm. Okay. So if you have the stroke checklist downloaded or anything like that, you can pull it up and then you can compare. Good effort, definitely. But for the sake of the standardization, right, we have to compare the stroke checklist so that you don't miss out any points. Have you gone through it by any chance?
Oh, yeah, yeah. I'll just
Yeah,
quickly
yeah.
read it. Sir, I don't have a list, but I can scroll down. But there are it has been mentioned in this PDF, so we can keep scrolling.
Mm-hmm. Okay, I think there's a message in this chat box. We can do one thing. So I've already done a presentation from one of my own journal clubs. You can keep this here. We have all the contents. What I'll do is I can open up the PDF so that you know what to use. Okay. So the headings, everything, we have to be a little more detail oriented. Now let me see if I can get a hold of the specific paper that you are going to be discussing with me. Okay, I think we're good to go for this. And also the cohort study that we have here. Let me just. So, if I'll also share this JC whatever I had presented. It's not perfect, but the format, if you follow it right, it should be standard practice from here on, so that at any forum for that matter, you will be able to present it in a very standardized way. All right. So let me just. Okay, can you stop sharing your screen? I'll share my screen. Okay, great. Just is it here? Where did it go? Okay, perfect. All right. So here we are. Can you see my screen now?
Yes, sir.
So this is a different paper, I understand, but it's still a cohort study. So you'll know what to follow through with this. So this is what I had presented. Point being, first of all, whenever you present it, right, keep it as simple as possible. You have to have a page number here at the bottom. First is you write the JC, you write the heading, and make sure to always mention the authors, whoever are there as part of the paper, because you have to acknowledge them. You're critically appraising that research paper. So you have to make sure that their names are always mentioned. All right. So, and then you write your presenter name and all of that. Next is you have to write about the journal itself. Now you call it journal club. You have to know how good the journal is in the first place. Without that, whichever journal it is, we cannot be trustworthy of it. So you need to acknowledge that also. So first you need to write the abbreviation of the journal. What is the journal name itself? So here it will be International Breastfeeding Journal, abbreviated as something else. Then published by whom? So you have to look at that also. Whether if it's BMJ, see it's BMC, right? So it's BMC who's going to be publishing it. What is the frequency of publishing? Okay, and also what is the impact factor of the journal itself, right? That's very important. Impact factor again tells you the quality of research papers being published. Okay, so I would leave my email out. So I'm sorry if I'm being like some very strict teacher or something, but I
No,
would expect that I would expect that you find out how you calculate an impact factor for a journal. Okay, because you have to select good quality articles. It depends on the impact factor. So find out the formula of calculating this. Okay, impact factor.
okay.
And you have to see its indexing, whether it's PubMed indexed or not, whether it's Scopus indexed or not, because that defines the quality of the study. So you cannot afford to have other indexes. It has to be PubMed index that shows a good quality. What is the volume,
Okay.
issue number? Reason being, they should be able to access the same journal which you have told. Open access means you don't need to pay for it. Okay, it should be peer reviewed. Some other doctors or some other clinicians, whoever it may be, should have read the same article for you to have read it. Citations means number of times other authors have cited your paper, I mean this specific paper in their journal, in their publication. Okay, so that is also important. It's a highly cited article, it means it's good, means that it's very well respected among its peers. So you have to write about this. This is one slide. Okay, next is the introduction. So whatever introduction you have here, basic, what are the main points? There's a lack of data on medication use. There are many medicines that are, not to be given during breastfeeding. Can you name a few major drugs that are not advised during pregnancy? I mean, during lactation? It's given in this only. Any idea? Hello?
Hello. Yeah, sir. Sorry, sir. Okay. I
Okay, so
cannot
it's
recollect at this moment.
okay. See, you can see this. I have just highlighted it right now. You guys can see it. There are a few medications that might be relatively contraindicated during breastfeeding, which include lithium, oral retinoids, amiodarone, gold salts, and anti-cancer medicines. So these are the medicines that you shouldn't give. That should be point number here in the introduction or your background, saying these are contraindicated, and this study aims to identify the most commonly used prescription medications and NPM among breastfeeding mothers. So that's how you kind of set the tone. That's how you're supposed to write whenever you write this journal paper. Okay. Next is you go to the objective. So that is the objective. You put it in a separate slide. Objective, the primary aim is to identify the most commonly used prescription thing. Next would be the secondary aim was to characterize so and to explore the differences in medication used by study site. So you literally have to copy and paste it here. Objective. Primary objective is the first one they've written it. Secondary aims also you need to write. And after that, next you go to methods. See, it's clearly given here also, right? So methods, even though they have written study population here, that's not the only heading. Okay. Make sure that the headings are very much there in all the things. First is the study design. You have to write that. That is prospective cohort study. Duration. they would have written here specifically, right? Between 2008 and 2012. That is the duration. So it's a 4-year study. Then study setting. Study setting means you have to write 4 sites across Canada. These are the 4 sites. So this is the study setting. Okay. So where was it exactly done? Next is study participants. That means how many? Total of 3, 5, 4 to mother infant were recruited to the child study. Okay. Next is ethical committee here. See, ethics board. Also, it was taken. Okay. So that is study participants. After that, you have to go for something called as inclusion or exclusion criteria. Okay. Inclusion criteria would be women were eligible to participate. That shows the eligibility criteria or inclusion criteria. If they gave birth to a singleton infant at more than 35 weeks gestational age. That is the inclusion. That means these mother and child dyad, DYAD, means mother is one and the child is another. So together it's called DYAD, dyad. Then infants born premature, less than or equal to 35 weeks with respiratory distress, complications, or fetal abnormalities, or born through IVF were excluded. So it's clear. Exclusion criteria also they've written. So a journal club, whenever you do, we have to dig and find out these headings for our presentation. So they would not have, all articles may not have given it in this heading, but for a person who is fresh to this paper, right, that would be your responsibility to put all of this in these headings. Okay, that is important. Next, after this would be what are the procedures followed or what are the medication classification that they follow. Okay, forget about this. This would not be applicable to you. Then, how did they select the community? They have to say large scale curation with ontologies. How will they see? If we go in from here, each participant, this is the procedure exactly. See, each participant was asked to complete a questionnaire. You have to mention this. These numbers are important. 3, 6, 12 months. You have already written that. That's very good. So, identifying any medications, any of these things, specifying the medication or product type. This procedure is important to us because we need to know what they've done is correct or not. So it's for us to criticize without knowing the detailed procedure. We cannot say anything. So procedure very much matters, okay, in the journal club. And you have to write specifying, then able to self-report their reason. There was no option to report indications, why they were given. So they just wrote, they were given these medicines. They didn't know exactly why. Okay, so medications were classified. This is important as prescription or NPM. NPM is non-prescription medicine. This is important because vitamins and all, right? Vitamin D, all of that, it's non-prescription. You go to Canadian any shop, you can get the medicine, these NPMs. So that is different compared to a doctor writing the prescription. So it was based on the individual drug monographs. All of these are bullet points that you need to mention. See, then prescriptions are further classified based on the drug database, all of that. Okay. Then breastfeeding was defined, all of this. So this paragraph is super important. Okay. Make sure that you mention it always. What are the exact things that were there? Wherever definitions are mentioned, we call them as operational definitions. So when we say breastfeeding, what do you mean? A non-prescription medication, what do you mean? We have to be very detailed oriented because for me, non-prescription oriented, I can go to a pharmacist right now and say, give me amoxiclav. That is non-prescription medication for me, my head. But as per Canadian standards, amoxiclav, amoxicillin clavulinate is prescription medicine, right? So that's why you have to be very specific here as to what they mean by it. That's how we will proceed. Okay. Now, large scale, this is what they did. Now, what happens? Sometimes they will say, for example, paracetamol, one person will say Dolo, one person will say Calpol. But both of them are paracetamol, right? So that's why they have used data curation with ontology. Ontologies means, see, medication brand names were corrected and the generic name were then identified. That's important. See, each pregnant mom will use different medical brand, right? Finally, you have to come to one generic thing. That's what matters. Okay. Then breastfeeding women, all of these details you have to sift through and write all of these important points here. Followed by extensive curation, all of this. Then after this statistical part here, see, look at this. Fisher's exact test. This is important. in your, I'm not sure if it was there in the presentation. Maybe I missed it. See, they've written here what test they used. Fisher's exact test was used to analyze categorical differences. Okay, 2-point P test, two-tail P was calculated based on this test. Analysis was conducted to compare this and this. Okay, with statistical analysis and a FDR correction. So this is what they did. We have to write what they did. Usually what we put, someone else would protocol, we just copy. But this is what they did. This is specifically what they wanted us to know about. Okay, very important. Next, whenever you, after all of this, see in my presentation as well. Now you go selection individuals, whatever procedures. So the procedures here is different. Here you have clearly outcome measures you have to write. What was the primary outcome? The primary outcome they measured was what medicines they used for medications. I mean, what medications they used during breastfeeding and non-breastfeeding women. That is very clearly given. Next, after this statistical analysis, I told you. So you have to write this as a heading and clearly write this paragraph, whatever I mentioned to you. Again, statistical analysis. This is results is like the also a very core component of a JC. Always use the tables that they have used. Okay. If you summarize, we might miss out on important data that we can kind of catch. Okay. Because as per your understanding, you would have summarized. That's fair. But for us to know if there is something more to add, for example, look at this figure 1. Okay. We kind of have these stars and all. Look at, they've written, oh, sorry about that. Let me just go down. It's misbehaving. Okay, cool. Sorry about this. All right. Let me just scroll down. Okay. Fit one page. You just go down here. Yeah, great. Okay, good. Now you guys can see a percentage of women reporting so and so, things like that. Now these stars are basically which is statistically significant. So analgesics and opioids. So they are kind of comparing between both groups, seeing which one is. Let me just maximize it for this. Between breastfeeding status, non-breastfeeding women and breastfeeding women again. You can see the color difference, right? You can say analgesics are significantly different. They have written it very clearly here. Where is this? Yeah. Odd. So it says that whenever there's a star, it's statistically different. Analgesic here and psychotropics significantly different. Herbal supplements significantly different. Vitamin mineral also significantly different. So you can actually, these are important points for us. We need to know which medicines are significantly higher between the two groups. So this will give us more information, just this one table, right? You don't need to spend time summarizing. We will try our efforts to make it easy for you to understand. Okay. This is about that. And then this also, socio-demographic characteristics. We have to kind of highlight, see country of birth. Now look at this. There's a p-value here that is significant. You have to highlight these p-values, whatever is there. So for example, if I go to my results, see, I have highlighted here which are the significant values, right? So these are different. Then here see p-values, right? P-value less than 0.05, less than 0.01. Here also you can see 0.02, 0.001, things like that. These are the ones that can help us interpret the data, because journals only will give like this tables only. So you should be good at interpreting tables. Without that, you will not be able to really get good insights. Your skill lies in how well you're able to decode this. Sometimes they'll unfortunately make it more complicated. So if you're able to do it very well, then it becomes very easy. So for example, look at this p-value here. This is 521 and 109 here. Okay. Between breastfeeding and non-breastfeeding women. Study center. Okay. It says Edmonton. Edmonton had significantly higher number of breastfeeding women compared to non-breastfeeding women. Toronto also had significantly higher. Vancouver also. Same with Manitoba. Understood? So again, if we look at some other example, okay, then age at delivery. So among all of these participants, significant. How many significantly higher number of people were 30 to 35 years of age, things like that. So we kind of know more information through these tables. You don't need to explain at all. Automatically, we look at this, we know, okay, this is what she is talking about. Now, if I go down to the next slides and all that. Next, again, these tables also. So these images, 10 most common prescription medicines. What were the common medications? This is also very important. So when we look at this, we know domperidone is commonly used, right? Between both groups, you'll know which one breastfeeding has more amount of domperidone. Okay, domperidone is written as off-label use. Off-label means it's not classically prescribed for increasing lactation. Domperidone primarily is used for what? Primarily, it is used for nausea, vomiting.
Nausea, yeah.
Yeah, so that is why it's called off-label, because you don't use it otherwise, right? So that's the concept behind off-label use. So you know what are the medications here? Medication used by site. See, again, why are they using it? This is also important. So domperidone, lactation disorder, GERD, that is only gastritis, correct? 97% is used for lactation. Only 1.38 is used for GERD. Right? Norethisterone's contraception. Why do people use it? This is important to us. We need to know why people are using it, so we can counsel them, saying, you have to use it carefully. What are the common issues? So mother is breastfeeding. Mastitis can occur. There may be abscess. So for that, you use an antibiotic like cephalexin. Right? So that's when you remember, okay, this mother is going to be breastfeeding the child. So if we're giving cephalexin, we have to tell them use it only for prescribed duration of 5 days or 3 days, depending on the course the doctor writes. Okay, so this is how we can clinically relate. That's how we can know that such medicines should be more carefully given, and these are very commonly given. So we have to be extra careful. These are all antibiotics, so you cannot just keep giving them for a long time. Correct. So even steroids for that reason, betamethasone, mupirocin, antibacterial creams, nystatin also for UTIs and things like that. Then after this, again, these are the at 6 months use. Okay, what is the commonly used reason? Domperidone is used here. Some antidepressants are here, sertraline, hydrocort is there for eczema. So these drugs should be discussed, because finally prescriptions based on whatever drugs you're giving. Okay, that is very important here. And yeah, again, this is again for 12 months. They have given specific tables. So now when you give 3, 6, 12 months, you'll know what are the trends of drugs that people give. Here. Now, after all of this, now all these tables are here. Again, you have to highlight these numbers and tell, okay, this is significantly higher than this. Always show numbers. Always show numbers. Any doctor or any OG or whichever thing it is, always show numbers. If you write a statement, anybody will ask you, where is the reference? So when you have this and you say this is higher than this, you'll show this table. As per this table given in this article, this is the value that they are showing. You have to show numbers. Okay. Medicine is always very important, always about numbers. Evidence is always shown in numbers and analysis. Okay. Making any statement, you have to be double careful. Okay. So that's an important thing that you guys need to look at. After this, now if I'll just go down to the next slides and that. All right. So again, these are all numbers. Same thing. So that is that. And yeah, good. Now I'll just come into this stroke guidelines. Now, I'll just take about 10 minutes. I won't spend much time. So this is a critical appraisal of the cohort study itself. Let me actually put it side by side. It's better. Okay, exit the slideshow. Okay, so first of all, the title and abstract here. Let me just show this. Title and abstract. Is the study design commonly used term in the title or abstract? Yes. Okay, provide the abstract. Is there information that is balanced summary of what was done? Yes, it is good. They have given a clear indication of whatever is to be done here. Okay, next. After this, you go to, sorry about that. Yeah, next is introduction. This is the introduction part, background. Explain the scientific background and rationale for the investigation. Yes. Objectives, state specific objective, including any hypothesis, they have given the objectives. Okay. Now from here on, you only should tell me whether they have fulfilled this. Study design.
Yes, yes.
Present key elements of study design only in the paper. Yes.
Yes.
Study setting.
Yes,
Setting,
it was
location,
mentioned.
dates, periods of recruitment, exposure, follow-up, data collection. I would say no, because they have not specified. They have said 3, 6, 12 months follow up. To an extent, yes. Okay, we'll give it. Participants. Have they given eligibility criteria, sources of methods of selection, how they have followed up? Yes, they have given it.
Yes.
For match studies, give matching criteria, number of exposed, unexposed. This is not a
No.
particularly a match study, but yeah, they have given it. Next is variables. Clearly defined all outcomes, exposures, predictors, confounders, effect modifiers, diagnostic criteria. I would say no. They have not defined all the outcomes. What are the predictors? Not very clear. They have just given medicine list. That's all. Confounders again, they have not given. Effect modifiers, they haven't given. Diagnostic criteria, they have probably given only for what is considered as breastfeeding women. So that is only one part. Rest of it, it's not very clear. Okay. Data sources, source of data, details of methods of assessment, measurement. So they have just told that they asked the person, right? Whatever self-reported. That's what you have also mentioned. So I would still say it's not very perfect. They have just asked them. So it's not very standardized. There's recall bias, correct? If there is a standardized thing, if there is like a proper discharge summary where they have clearly written what medicines they were given, that is one thing that you can measure. This recall bias is there. Mom may forget. She may not have taken domperidone. She might have taken something else. So it is not very reliable. Bias. So describe any efforts to address potential sources of bias. So some efforts are there, like we talked about, those different brands, no? They've kind of combined everything together to make it streamlined. But recall bias and all, they have not really taken into account. Next, study size. How the study size was arrived at? No, they haven't actually. They have just told here 3, 5, 4, 2 mother infant. That's it, they have told. So no, that's not done. Quantitative variables, explain how quantitative variables were handled. Which grouping, subgrouping you told me. So some part of it, yes. Statistical methods, all statistical methods include those, not very detailed, honestly speaking. Very superficially they have explained. Method used to examine subgroups, they haven't. How missing data were addressed, they haven't told. How loss to follow-up was addressed, I don't think they have told. Any sensitivity analysis, not done. Results, again, participants. So number of individuals at each stage, there's like a proper flow chart that will come. Have you guys seen it? I'm not sure. First, they will collect so many numbers. Then they rule out few more numbers. Then they enroll into the study so many numbers. They have to rule out so many numbers. All those should be also clearly mentioned. They haven't mentioned it. Okay, completing follow-up. How did they analyze? Give reasons for non-participation? No. Consider, have they used a flow diagram here? They haven't used the flow diagram. Saying, 100 patients came, mother and children, they excluded 10 because they were not fulfilling the criteria. They have to give numbers. That's how detailed it should be. Okay. Next would be number of outcome events or summary measures over time. Number of outcome events they have not really mentioned. And main results. So there's something called adjusted and unadjusted, too much detail. But yeah, they have not given as 95%. Have they given here 95% confidence interval? Let's see. These are all proportions, so you don't need it. So that's okay. Then other analysis, subgroup, they have not done too much. Sorry about that. Yeah, key results with reference to study objectives. Yes. Limitations, they have told. That's fine. Any potential bias, they have told this is the limitation. Interpretation, they have given a cautious thing. Limitation, multiplicity, generalizability, externality, you told it's only for Canada and all that. Funding also, they have mentioned here at the bottom, if they have received funding. If you just see the bottom part here. There's the funding part. Yeah, Canadian Institute, they have funded by so-and-so. Ready for Innovation Fund at the University of Manitoba. Things like that. Okay, so this is how detailed oriented it should be, a journal club. This is like a very national, almost an international standard that I'm wishing you guys should reach. So very good effort. I know it's not easy presenting in front of so many people, and this is important that you learn the solid way to do it. Maybe there are a few more corrections. Maybe if some other person comes in, they'll add a few more things. But more or less, you have to put in these many number of headings, make it very organized, and always read up more, because see all these references, right? There are so many here. So my first question will be, what is the percentage of exclusive breastfeeding in India as per National Family Health Survey, latest statistics? Because when you're doing all of this, you're expected to read up on that also. Here you said they are expected to reach 90% and so on. Any idea how much Indian breastfeeding, exclusive breastfeeding statistics? Anybody? I'll be very happy if you can answer. Anybody? Okay, so it's 64% as per NFHS 5. And these statistics, again, you kind of need to know, because these are always supposed to be compared to the Indian setting. This is a Canadian study, I understand. But you guys would be here in Indian setting, you have to see and you have to learn about all these things. So yeah, I think this is the overall overarching thing. I'll share this JC presentation over email. If anyone requires, I'll share it with the organizer as well. So yeah, I mean, good job. If there's any queries, I'd love to answer them. I think I gave too much of gyan and information. So,
Okay, so I think the platform is open for an question and answer session. You can drop in your questions in the chat box or raise your hand if you have any questions. So we have received some questions.
mhm,
So I'll be reading them out. How
mhm.
could future studies improve upon self-reported medications and breastfeeding data?
Can you repeat? How can research studies?
Yeah. How could future studies improve upon self-reported medications and
Mm,
breastfeeding data?
okay. So instead of self-reporting, one thing is at the clinic itself.
Mhm.
When the doctor, that's what I said, no, if there's a prescription. So it's all about how documented evidence versus what verbally they say should be corroborated. Okay, corroborated
Right.
means it should match. Okay,
Mhm.
that's possible only if a doctor prescribes a certain medicines or writes, and that doctor itself records in their own Google form or physical paper on so and so patient, name, age, so and so, breastfeeding since at 3 months of with a 3-month baby, These are the medications that they are taking. So, and these medicines, the doctor would write in the form also. Prescription will be there to cross check. So there is cross validation that's happening. Self-reported, see, you don't know the educational status now. Here, at least Canada, many are educated, right? What if you go to some backward place, like a tribal village? What the woman would just say red color tablet, blue color tablet. How can you kind of, notice? It's a very problematic thing, recall bias and poor education status. Or sometimes they may not be okay with telling some things. If what if you tell like contraceptive, right? Why would a woman be confident to tell that she's taking contraceptive immediately after she's had a kid? All these things matter. So if a clinician or if there's a dedicated person who's collecting the data and checking with the prescription, he should take the picture of the prescription and enter data. So for each patient, you can cross check. That's what I would say.
Okay, sir. Thank you. There's another question that we have received. What more is needed to create clear, accessible guidelines for common postpartum medications?
Okay, clear, accessible guidelines. See, for postpartum medication, right? Mainly, we have to just know the list of those that we strongly need to avoid. That is
Mhm.
like you should have. See, as a whatever you learn in OBG or anything for that matter, there's no guideline per se to say these medications should be given or not be given in the overarching sense. There will be lists of in pharmacology itself, like in this article, right? You have already messaged in this Google, in this chat also, so you know what to completely avoid. Rest of it, it's up to the obstetrician to kind of monitor.
Yeah.
So it's all depends on how well they're monitoring and be very watchful for any adverse effects. So as part of regular medications itself, you just need to be well aware. And see, guidelines is this, it's something like this. Okay, different conditions, different medications, and it's about combining everything together. For example, there may be a diabetic mother or a person with bipolar disorder who's at risk for, they might be on lithium or something like that. So different disease conditions, different medicines. So it's about, there's no specific only on lactation, these headings. All of these
Mhm.
articles are combined from many places. So having an overarching language, understanding is the only way forward, in my opinion. Because the more and more cases you see, more and more problems, you'll know which to avoid. So
Yes, sir.
clear, like X category drugs of what is absolutely to be avoided. Yes, know them. Remaining, be watchful. That's it. Yeah.
Okay, so there's one more question. How can policymakers use this data to better support breastfeeding women?
Okay. So one thing is policymakers would be, first is education of patients, knowing what
Mhm.
medicines they're on. So educating patients. Now there is something called as VHSND, Village Health Sanitation and Nutritional Day, that happens in the community setting. What happens is every fortnight there's a village day or something that happens where kids come for vaccination. Okay.
Mm.
So, 6, 10, 14 weeks. That's very classical. 1.5 months till 4 months. So that's classically in the same period. Mother will be breastfeeding. So that's the opportunity where they need to put in the guidelines as to what medications they're on. What have you gone to your obstetrician? Have you gotten it checked? So most of these women who are suffering are those in this rural area only. They are the majority. It's like 75% of doctor and patients are treated by 25%. Rest are in metro cities. Only one third are treated by 75% of doctors. So in rural settings, these ASHA workers or ANMs, they need to be made aware of what medications the women are also on, because they'll
Mhm.
be breastfeeding the child. So that is at that level. Education, I think, is number one. And when they dispense these medicines, right? So they will write prescription audit, will be something that they do. Prescription audit means they'll see which doctor has written for what reason they have given so and so medications. Vitamin D, why have they given? Why have they given? An antidepressant. What is the exact reason? You have to justify. You have to write the proper diagnosis. So prescription auditing. So policymakers would go into that area.
Mm.
And another thing is, in general, women should be well educated about what they need to do. So another thing, there's something called a mother and child card. Okay, uh, mother and child protection card, MCP. So there's everything on vaccinations. On do you guys know what is weaning? After 6 months, you start feeding them small feeds, right? All that detail is given to the mom. How you will notice, growth stages of the child. When do you kind of bring the child to the hospital? In that also, they can just write saying medicines are what medicines are you on. So next time they'll write and come, or they'll bring the parchi or the slip of whatever doctor saying. They'll show it to the ANM or the ASHA worker. That time, okay, these are the medicines. They'll inform the doctor. Acha, there's a blacklist. If someone is there in that medicines list who's on such a medicine, then they'll immediately inform the healthcare provider, like a doctor, like Doctor so and so woman. She's breastfeeding. She's taking these medicines. What do we do? So including in that card is one of the ways that they can avoid. So
Yes.
yeah, I think see at the doctor level, at the community level, from the community worker and from the mother's level, all three are important. Kid to what? A kid is small. No? You can't educate the kid. So
Yeah,
that's what you guys at the policy level. Usually, this is what would be. I would say would be needed.
absolutely, sir. This is a final call to all the attendees. If you have any questions, please put up in chat box or raise your hand.
Yeah.
Okay, I think there are like no more questions. Just a quick information for all the attendees. There's a post questionnaire link that has been shared in the chat box. Please do fill it. Only if you fill the form, you'll be eligible for the certification. Please do that. Also, sir, thank you so much for digging into deeper avenues of the paper. It was really helpful and insightful for all budding and new researchers. And great effort. So thank you so much.
I'm glad to help. So,
Yeah,
Harshita, good effort. Don't feel bad if I pointed out too many things. It's part of learning. I've also been there, done that. So, I'll share it on the email, the JC article. It's perfectly fine, I think. Yeah, wish you guys all the very best. It was a pleasure speaking to you all. So, yeah, take care then.
yeah.
Thank you.
Yes,
Thank you
sir.
so much, sir.
All right, all right.
Thank you, sir. We are wrapping up the session. Thank you so much for attending.